before I start this, I'm going to verify that I have an order from the physician to place an NG tube and perform hand hygiene. Hi, my name is Amber. I'm going to be your student nurse today. I'm going to look at your wristband. Can you tell me your name and date of birth? Thank you. Okay. I'm going to provide for privacy and raise you up to about waist level, and I would raise the head of the bed up. Okay. I'm going to, do you know what an NG tube is? Okay. That's a tube that I'm going to put in your nose and down your throat into your stomach, and it's going to get nutrition into your body and alleviate some of the pressure on your intestines and bowels. It is going to be uncomfortable for a few minutes, but after the procedure is over, it won't hurt anymore, okay? Do you have any questions? Great. So, this is the NG tube, and I'm going to use it, and I'm going to measure it from the tip of your nose to your earlobe, down to your xiphoid process, okay? And then, depending on hospital policy, I may or may not add 6 inches. Okay, I'm going to mark that so I know where to stop. Going to put this bath blanket over their chest, and I'm going to put on gloves and lubricate the tube 2 to 4 inches. And then if I have anesthetic and the patient wants it, I will apply anesthetic to the nose, and if we have any spray, I'll put it on the back of the throat. So I'm going to go ahead and look inside of your nostrils, okay? I'm looking for a deviation. I'm going to plug this nostril, breathe through that one, okay? Now breathe through this one. Which one was easier? Okay, we're going to go with this nostril. So, put my emesis basin here and the cup for him to drink out of while he's swallowing. But since he can't hold it, I'm just going to sit it over here. Okay. When you're ready, I'm going to go ahead and insert. Tilt your head up, okay? I'm going to go up into the nose. Okay, and now I've reached the pharynx, and you can usually tell because the patient is gagging. All right, tilt your head forward for me, okay? Tuck your chin to your chest and swallow, swallow, swallow. Sip on that water, okay? Okay, I have reached the point I take it off, so I'm going to grab a piece of tape and secure it loosely. I'm going to attach a syringe. Okay, now that it's attached, I'm going to aspirate 30 milliliters of air into the stomach and listen for a swishing sound. Okay, ready? I did hear a swishing sound, which means I am probably in the stomach, okay? Now I'm going to aspirate 30 milliliters of gastric contents out. I'm going to clamp the tube and disconnect the syringe. I'm going to look at the color and consistency of the tube and leave that clamped. Okay, now I'm going to put it on my pH paper and measure the pH and throw that in the trash. And it is acidic, so we are probably in the stomach. Per hospital policy and orders, I may get a chest x-ray or anything else they require. So now I'm going to apply a skin barrier to the nose. I'm going to get another piece of tape and cut up the middle. Disconnect this tape. Okay. I can turn your head that way for me, as far as it'll go. And I'm going to really quick, before I secure this, going to measure from the nose down to how much tube is left and record that. Okay. I'm going to remove the syringe if there was one and attach it to suction. If this was a double lumen tube, I would only attach one part and make sure it was above the stomach. Okay. Going to get a pin and attach it to the glove. Good. Okay. Now that the patient's gown, the tube is secured to the gown, I will remove my gloves and put on more if needed and provide oral hygiene, any tissues or anything they need, and I would continue providing oral hygiene every 2 to 4 hours. Then I'm going to make sure the bedwells are locked, put the bed in the lowest position, open the curtain for privacy, give them their collar, and wash my hands again. To remove the NG tube, I'm going to again verify the patient order, perform hand hygiene, and ID my patient again. And I will explain what's going to happen again, okay? So to remove the NG tube, it's going to be uncomfortable just for a second, and then it'll be over, okay? So you're going to have to take a deep breath in, and then hold it, and I'll pull it out real quick, okay? So I'm going to go ahead and provide for privacy, and raise the bed up to my waist level, and raise the head of the bed. I'm going to go ahead and put on some gloves. Okay, I'm going to unpin this from your gown. Okay, and I'm going to disconnect it from suction if it was attached to suction. Okay, I'm going to get my syringe and flush the tube with 10 milliliters of water to clean the system. Okay, and I will clamp tube and I'll disconnect the syringe. Okay, I'm going to remove your tape. I want you to take a deep breath in, okay? And on 3, I'm going to start pulling it out. Ready? Hold your breath. 1, 2, 3. Okay. I will dispose of the tube, and I will perform mouth care and provide tissues as needed. And I'm going to lower the bed to the lowest position, make sure the bedwells are locked, open the curtain for privacy, give the patient their collar, wash my hands. Okay, then I'm going to apply gloves again and measure the contents in the drainage tube and the output flow. I'm going to put that in the output flow chart. I'm going to get rid of this towel, put that in dirty linen, wash my hands again, and make sure the patient is comfortable, and I've completed this skill.